This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, from Philadelphia to Erie and from Pittsburgh to Scranton, it's Behind the Headlines. I'm Charlie Greenawalt, Senior Fellow of the Susquehanna Valley Center for Public Policy. Maura Donnelly is on assignment. But however, I'm lucky enough to be joined by another board member of the Susquehanna Valley Center for Public Policy, Ann Womble. Ann, welcome to the show.
Thank you, Charlie.
Well, it's nice to have you back. You've done this before.
I have, and I am glad to be here.
Oh, we're lucky to have you. And we're also lucky to have one of the most important people, one of the most noteworthy people in the Commonwealth in terms of state government, and that's a former board member of Susquehanna Valley Center, the president of Penn Waste, and the state senator from the 28th District from York County, and that's Scott Wagner. Welcome to the show,
Thank you, Charlie.
Senator Wagner.
Happy to be here.
Why, you are the chairman of the local government committee. You are the vice chairman of Labor and Industry, and you're also on the Intergovernmental Operations Committee, the Transportation Committee, and the Appropriations Committee. You are a busy person. Is that fair to say?
I am a very busy person, and I've got a few other things going on in my life, but I'm very busy, yes.
And it's been rumored that you are running for the Republican nomination for governor as well. I've heard that somewhere.
Well, we announced formally on January 11th, so we're running fast and hard.
Well, you have been so busy that also in this session for 2017, you have sponsored 123 bills and resolutions. Out of all the bills and the resolutions that you've sponsored, which are you most proud of, or which do you consider to be the most important, Senator?
Well, Charlie, without having my legislative director here, we go through, these are co-sponsorships, so I'm a co-sponsor on those bills, and we go through each bill, line by line. There are some local government bills that will come through my committee when we hold the local government committee. Actually, I think we have a meeting today. But the process, a lot of bills that are introduced by members have to get through respective committees. They will go through local government, and then they will pass through the Appropriations Committee, and then go to the floor for a vote. So, probably the one that I've lost a lot of sleep over is Senate Bill 1, which was the pension bill. And the Senate went into session this past Sunday evening at 7 o'clock. We then adjourned for an Appropriations Committee meeting, and Senate Bill 1 was voted out of committee. I was the only Republican negative vote on Senate Bill 1 coming out of committee. And then yesterday, on Monday, the SB 1 went to the floor and was voted. I think the vote was 40-9 in the affirmative, and I was a no vote. And I'll explain why I'm a no vote. 2 years ago, in the 2015-16 legislative cycle, the Senate and the House passed Senate Bill 1, and we sent it over to Governor Wolf's desk, and he vetoed it on, I think, July 9th of 2015. That bill, that Senate bill, that pension reform dealt with 401k, changeover, conversion. It dealt with a lot of issues in the pension plan that we're facing in Pennsylvania, but the governor chose to veto that. And the reason that Governor Wolf vetoed that is because he had so much pressure from the public sector unions. I mean, Governor Wolf gets an incredible amount of money. It's breathtaking from the public sector unions, specifically the PSCA, AFSCME, and the AFL-CIO. They don't want any changes to this system. But the bill that was passed on Sunday evening out of Appropriations, and then the actual bill that we voted on yesterday, it's an opt-in, opt-out. It really doesn't do any heavy lifting. And listen, my colleagues have put a lot of time and effort in this, and I applaud them for doing that. But at the end of the day, I think we have to have a real conversation. We need to look in the mirror, and we need to say, listen, it's time to make some changes. Now, Charlie, I gave you a handout several weeks ago. The Auditor General issued a press release and his findings of the audit of the PSERS pension fund. And PSERS stands for the Public School Employees Retirement System. And the findings in this report are pretty interesting. But what stood out to me in flashing lights is at the very bottom, The assets that were invested in 2016 are $49.2 billion. That's with a B, billion dollars, okay? The return on those investments was 1.29% on $49.2 billion. This is disgraceful. And I'm going to say this on this show. We could go to probably any school and find 3 third graders that could have outperformed these guys, okay? Probably have done 8 to 10%. Last year, 2016, was one of the best years in the stock market that we've seen in probably a decade. And it's 1.29%. So if you factor 1.29%, I don't have a calculator, but it's about a $550 million return on the 49.2. Well, the money managers were paid $416 million. I mean, the money managers got almost as much in compensation as this pathetic return of 1.29%. So, I went to Frank Ryan, who's a new House member from over in Lebanon, and Frank's he's a CPA and has an accounting background. And several weeks ago, I asked Frank, I said, if we just did a 2% better return on all the money that is invested, what would that equate to? $20 billion. I saw him at an event last night. He said, Scott, I have the answer. So this is, we have a benchmark return goal of 7.5%. It was lowered to 7.25%. I mean, this in my world is pathetic, and these money managers, every single one of them should be fired. But if you go back and you look at the PSERS board, there are representatives from the Senate, Democrat and Republican. I believe there's a representative from the House, Democrat and Republican, somebody from the governor's office. This is absolutely disgraceful and pathetic, and every single money manager should be fired and they should be replaced. The other problem we have in the pension system is we have over 300 money managers managing approximately $60 to $70 billion. We should be doing this with probably less than a dozen money managers. But again, yesterday's bill, Senate Bill 1, it really isn't doing any heavy lifting, and we need to do some heavy lifting. And Governor Wolf's going to run around and say this is a victory and it's going to be wonderful. Listen, Governor Wolf right now is running for re-election. He will vote for anything that is breathing, that gets sent over to his office. He's up for re-election. This is what this is all about. But I will sit here and say that this pension bill that we passed yesterday doesn't go deep enough. The governor should have approved and signed the bill back in 2015.
Senator, aside from the pension issue, your website theme is Fix PA. What would you say are the other issues that Governor Wolf has either ignored or not fixed?
Well, Governor Wolf came into office, and the very first thing he did in his first budget was he wanted almost a $4.5 billion tax increase. Governor Wolf is not doing any deep dive initiatives into agencies to eliminate waste, fraud, and abuse. And there's a lot of mismanagement. I mean, listen, I could sit here for hours and go on about the waste that I see. We just wasted $410 million on a computer system upgrade at Labor and Industry over a 10-year period. The Auditor General just did an audit in the last 2 months, and he came back and said that the systems that is in place was put in 1958, a year before Alaska and Hawaii became states. And then we have the $1 billion radio system out there that we wasted $1 billion on a statewide radio system. We have nothing to show for it. You need an executive in the state of Pennsylvania that's going to go into these agencies and do deep dives, okay? That's what needs to be done. And, then the other crisis, let's talk about a crisis. We have a financial crisis on our hands, but, the solution is, let's just raise taxes on everybody. That'll solve that problem. But there is one very, very large crisis in Pennsylvania right now, and that's the heroin crisis. And Governor Wolf has all of a sudden wrapped himself around that, and he's the white knight. He rode into town, and he's going to save the day on his white horse. You know what? It's almost, Governor Wolf, I find, it's actually offensive what he's doing right now, because in his own home county, in York, Pennsylvania, the district attorney's office, the coroner's office, and I was part of this initiative, we formed the York County Heroin Task Force in 2014. At the end of July, we formed it. And we've almost been in business for almost 3 years in York County. He hasn't even acknowledged the work we've done in his own home county. He says he lives in York, but he really does. He lives in Philadelphia. But at the end of the day, the heroin crisis right now, and I'm going to throw a random number out there, it's bad. It's off the charts. The general fund budget in Pennsylvania is probably $30 to $32 billion. I believe that the heroin crisis is probably, at a minimum, is somewhere between $30 and $50 billion to the Pennsylvania economy. I mean, it's, you know, if you look at absenteeism, you look at, you know, health insurance is picking up, you know, some of the costs. You know, there are disability costs. There's all kinds of broad costs. Right now, I think that's our largest, you know, crisis.
Well, Senator, what can and what must we do to deal more effectively with that problem?
Well, I'll tell you a quick story. When I, in 2014, I was sworn in April of 2014. In August of 2014, I met with all the York County school superintendents. We had a meeting. It was a, you know, private meeting, and to talk about, you know, what I saw in Harrisburg, sort of my 5 to 6 month progress report, what were their issues, you know, how can we work together. And so we had a good meeting. And at the very end of the meeting, I concluded the meeting and just, you know, with some statements and said, listen, you know, also I don't know what you're seeing with drugs in your schools, but I've been involved in the formation of the York County Heroin Task Force, and I learned something. I knew that Baltimore was a very large heroin distribution point, but I did not realize that it's the nation's heroin capital. Okay, and where I live in York, Pennsylvania, I get my car, go to 83, and go south on 83 and be in Center City, Baltimore, in probably 50 minutes. It's a 55-minute drive, or excuse me, 55-mile drive. So we have that dynamic. But, you know, at the end of when I was concluding sort of my comments, we formed the York County Heroin Task Force, and, you know, I don't know what you're seeing in your schools. The superintendents responded and told me, and this, Charlie, and Ann was just sort of breathtaking for me. Well, we're not hearing much, and, you know, we're not seeing much in our schools. And I'm like, you have to be kidding me. And so I said, you know, I could go to your school and find a student, and I don't remember if I said $20 or $50. I can go to one of your schools, get a student, and either give them a $20 bill or $50 bill, and 10 minutes later they'll come out with heroin. Well, there were, I think, 14 or 16 superintendents in the room, and half of them won't even speak to me today. You know, the school districts have kept their heads in the sand over this whole thing, and I think we missed a whole generation. But listen, I'm going to say this on this show, but it's the truth, and people need to hear the truth. A lot more people are going to die. It's a fact, because we have not educated, you know, people. And I believe that a pre-kindergarten student, I don't care at what age they are, when they are in a learning experience. Children, if they're 5 years old, they have to hear that drugs are bad, needles are bad. It needs to continue. I was with someone over the weekend, and they're actually in the school system, and said that their drug education program stops at 5th grade. They need to hear this the whole way through. The prescription drug epidemic has really been the gateway to this. You know, I saw in my business at Penn Waste, in my previous waste company, but really 15 years ago, we would have injured workers with a sprain or strain go to a work hospital, you know, the industrial resource facility down in York, or, you know, one of the emergency rooms. We have a contract with you know, a facility where they handle work-related injuries. Our workers were walking out with prescriptions for 30-day prescription for OxyContin and Vicodin. I mean, this is 15 years ago. In 2012, I came to Harrisburg. I wanted to see some workers' comp reform. This was before I joined the Senate. I went to Labor and Industry. I met with six attorneys and 4 legislative people and a deputy secretary at Labor and Industry. And I was really just trying to reinforce we have this prescription drug problem, and there were a couple other issues. I never heard back from anybody. They simply don't care. And so, you know, you have children, high school students, you know, 14, 15, 16, 17, 18, you know, going into their parents' medicine cabinets and emptying all their pills, and they bring them to a party and they put them in a big bowl and they just take pills. We have to educate.
Senator, we've just started. We are just getting warmed up, right, Ann?
Right.
I am so sorry. We need to ask you to come back. We're out of time, unfortunately, and we're just scratching the surface. So thank you very much for coming today.
Charlie, there are a lot of issues in Pennsylvania, but I think we can solve these problems with the right leadership in the governor's office. That's what this is all about, and we're not getting it right now.
Okay, very good. All right, we'll be back with the second segment of Behind the Headlines right after this. Stay tuned.
Behind the Headlines is brought to you as a public service by the Hospital and Healthsystem Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Chamber of Business and Industry. The Pennsylvania Chamber serves as the frontline advocate for business on Pennsylvania's Capitol Hill by influencing the legislative, regulatory, and judicial branches of state government. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Hi, welcome back to Behind the Headlines. On this segment of Behind the Headlines, Ann and I are fortunate enough to have with us Andy Carter. Andy is the president and CEO of the Hospital and Healthsystem Association of Pennsylvania. Andy's been a guest with us in the past, and one of the persons that we learn more about Pennsylvania's health than anyone else. And it's so nice to have you join us again, Andy. Thank you.
Thank you for having me, Charlie.
Oh, you're quite welcome. I'm going to throw you to Ann for the first question to start us off.
Thank you. Well, welcome, Andy.
Thank you.
Healthcare, a big topic for everyone in America. Can you tell us what are the latest efforts going on in Washington, and how does that affect your organization?
Boy, it's a huge amount happening. In fact, in many respects, too much is happening. As you know, the U.S. House passed a repeal and replace bill that raises tremendous concerns for us. And I'll tell you why, basically in the context of all that we've been able to accomplish through the Affordable Care Act over the last several years. We have 1.1 million more people enjoying health insurance coverage. And we have seen a dramatic drop in the percent of people who don't have insurance, a 40% drop in the people without insurance. And we've seen an almost 9% drop in uncompensated care and bad debt for hospitals. So good things have been happening that this bill puts at risk. So basically what's happening now is the Senate is working to see if it can come up with a plan that meets what we all want any kind of reform plan to meet, which is to preserve that coverage gain, particularly in Pennsylvania.
And what will that do to Medicaid expansion, for example?
Well, I'm glad you asked, because one of the House initiatives is to do two things. One is pretty much over a several-year period eliminate enhanced federal funding that made it affordable for states to expand Medicaid. And if they take away that enhanced federal funding, it seems pretty clear that the state of Pennsylvania could not afford to continue that expansion. And that would put at risk coverage for over 700,000 people. So that kind of Medicaid reform is very dangerous. There's a second dimension of the House bill that we are having intense conversations with policy leaders in Washington. And that is to change Medicaid from basically an entitlement program to one where the Commonwealth would receive a flat fee per person. And that troubles us deeply because we don't think there would be enough resources in place to continue to ensure adequate coverage for children, people with disabilities, and most importantly, older Pennsylvanians who receive a great amount of skilled nursing facility care, nursing home care. So that's troubling. That's not the kind of reform we want to see.
You were talking, Andy, about the possible effect of on Pennsylvanians as a whole if the Affordable Care Act is repealed or replaced. Specifically, what will happen to the hospitals if you look just at your organizations that you represent? If that is repealed, you talked about, what is it, 8% of...
Almost 9% reduction in unpaid bills.
Okay.
And
beside that, what are the other implications for your members?
Well, that's a very important one. For us to lose the resources that we use to provide care to people would be devastating. And if all those folks lose coverage, we're going to see an immediate return to days when people are getting care without insurance. It puts a huge financial strain on hospitals. And ultimately, it forces us to pass on those costs to government and to pass them on to the private sector. people like you and me who are paying our own private health insurance, our rates could go up because hospitals have to provide care. We're required by law to treat anyone who appears at our doors, and so we have to pass that cost on. So that's a huge impact. Equally important with some of the repeal strategies, hospitals would be at risk of turning back the clock on all the work we've done to improve quality of care. We've made huge gains in reducing medical errors and reducing infections in hospitals, and much of that work is supported by direct funding from the Affordable Care Act, but also by the fact that with more people insured, we have more reliable insurance revenue. We're able to stay on track improving the quality of care. So that's another huge risk.
What is HAP doing specifically to advocate for preserving coverage?
Right now, we are going to pretty much pull the page out of the playbook we used in the House. We worked with members of the House delegation, and we're very grateful to 4 Republican leaders from the Pennsylvania delegation, Congressman Meehan, Dent, Costello, and Fitzpatrick, each very courageously voted against the House bill. They were responding to concerns about lost jobs in Pennsylvania, the impact on hospitals. So we want to take that same message to both Senator Casey, who's declared his firm opposition to the House bill, but also to Senator Toomey, who has expressed a strong openness to the kinds of principles embedded in the House bill. But we want to share with Senator Toomey the risks to Pennsylvania jobs, the risk to our economy, and of course, the loss of coverage and all the damage that can do to the quality of life for Pennsylvanians. So right now we're focused mostly on Senator Toomey.
In a day and age, Andy, where we hear more about workplace violence and we hear more and more about terrorism, we know hospitals and hospital staffs are on the front lines in treating traumatic injuries as well as illnesses, but most of us don't consider the personal safety of the hospital staff. Can you tell us a little bit about what Pennsylvania hospitals are doing to raise an awareness of workplace violence, and what can we do about that?
Well, thank you. It is a very important issue. The reason it's not top of mind is because obviously generally hospitals are very safe places. We take steps to ensure the security and safety of patients, visitors, and families. But we do know we have to be ready for example, an active shooter. It happened last year in suburban Philadelphia, and so hospitals take very seriously their obligation to adopt national best practices to keep campuses safe, to guard against escalation of issues that can turn violent. We ask employees to go through training to help them do that. But we also not only taking care of immediate incidents that could arise in a hospital, we're also very committed to helping to reduce violence in our communities. There are some tremendous programs from UPMC and violence prevention training that they do in Western Pennsylvania, all the way over to Temple University and their efforts to help teach youngsters in Philadelphia what the ongoing damage is in a community from needless violence. For example, they go through a program where they learn what the last 15 minutes of life is like for a shooting victim at a trauma center. It's a hugely impressive exposure for these kids to see the harm that results. So we're very committed to reducing that, both in our 4 walls, but also out in the communities. And we did celebrate on Friday, June 9th, Hospitals Against Violence, a national movement that is designed to bring attention and raise awareness.
Another question. You've recently released your 2016 Economic Impact Report. Can you tell us a little bit about those findings?
It shocks people to be reminded how important the hospital community is to the health of our economy. Every year we take stock of that using publicly available data, and this year it's a $121 billion impact on the Pennsylvania economy. And part of that impact comes from the fact that we employ almost 600,000 Pennsylvanians, both directly and indirectly. People, for example, working at the uniform cleaning companies, for example. And that represents almost 1 in 10 jobs in Pennsylvania.
Mm-hmm.
So when policymakers look at steps they would need to take to address hospital funding, address Medicaid, address Medicare, it's very important to keep in mind that the financial health of hospitals is as important as the health of all Pennsylvanians. And something like the American Health Care Act, the repeal and replace effort, is the kind of step that really takes us in the wrong direction in terms of preserving that economic stability in Pennsylvania.
Mm-hmm.
Andy, the budget deadline is coming up June 30th, and we wondered what was at stake for the hospitals in this particular budget, and how do hospitals fare in the particular budget that the legislature is entertaining at the present.
We are concerned that the House budget led to a $6 million cut in critical funding for critical access hospitals, which are our smallest hospitals. There are 15 of them in largely rural communities of the Commonwealth. They cut funding for burn centers and for maternity services in hospitals. And we're working with both the House and Senate to get that $6 million cut restored. Beyond that, we're keeping a very close eye on these last-minute discussions about how the state will achieve a balanced budget. We certainly want to guard against any effort that would further undermine the resources hospitals need.
Mm-hmm. Mm-hmm.
Now, you've been here in Pennsylvania for how long, Andy?
About 4.5 years.
4.5 years. Now, you came from Maryland.
I was actually running the Visiting Nurse Associations of America in D.C. before coming to Pennsylvania.
I wanted to get your opinion of how we were doing vis-a-vis how our hospitals are stacking up against Maryland's. How are we stacking up nationwide, Andy?
Well, nationwide, we are among the most successful hospital communities in a number of fronts. Our progress on quality is striking, and financially, while we do keep a very close eye on the overall financial performance, we're doing pretty well. And we are in some ways leading the nation. And for example, we are ahead of the national average in terms of engaging physicians in new ways, principally by bringing them into hospital organizations as employees and helping us to align the quality of care more effectively by working more closely with physicians. And we're ahead of the curve on that. And we have some really fine institutions with innovative clinical breakthroughs, curing diseases, improving efficiency, and containing the rate of growth in healthcare costs, which is something everybody, Republican and Democrat, wants to do.
Okay, thank you very much for coming, Andy. We can't thank you enough for the update. We're looking forward to your next visit. I want to talk to you a little bit about 3D printing. If the Japanese are building skyscrapers with 3D printers, I know that human organs can't be far behind. So we'll see you next week on Behind the Headlines. Tune in then.